Welcome back. According to DHEC, South Carolina ranks 8th in the country for the highest prevalence of diabetes.
What's even more alarming is the rate of diabetes amputations in our state and even right here in the Midlands. Intisar Faulkner has more in tonight's Health U.
A national epidemic hitting close to home. Diabetes amputation procedures have increased year after year across the country. And one of the hardest hit areas right here in Richland County. Between 2016 and 2020, approximately 10 of every 10,000 residents in the 29203 zip code received a lower limb amputation due to damage from diabetes.
There's been some staggering statistics in our community as far as being one of the higher rates of amputation in the country per capita.
In fact, the number topped the amputation rates of zip codes in Charleston, Atlanta, Montgomery, and Jackson, Mississippi. Dr. Brett Fowler, vascular surgeon at Lexington Medical Center, says limited access to resources plays a big role.
It's very prevalent in those of low socioeconomic status because of access to care, which is a huge problem that we see and we face. Unfortunately, the way where the statistics are, African American population are hugely affected by that. We know that it is prevalent across both genders and can lead to a variety of complications.
And both the procedure and mortality rates are much higher for Black patients than white patients. According to a 2018 study in Podiatry Today, between 52 and 80% of diabetic patients die within 5 years of a below-the-knee amputation.
Amputation is a treatment but doesn't cure all disease that leads to it. A lot of vascular disease can be prevented with the right care up front.
And although family history can be a factor, preventative measures can still be taken.
There are risk factors that we can prevent, smoking being one, lowering blood pressure, and then having good cholesterol levels, and then kind of routine things like diet and healthy exercise.
Fowler says it all comes down to early detection.
In order to really have an impact on, first of all, the disease process of diabetes and the downstream complications, but amputations, it really needs to be recognized early, and that's the most important.
Really good information there, Intisar. If you or a loved one are at risk or currently a diabetic, there are several resources available in the Midlands. Lexington Medical Center offers 2 types of classes. The diabetes education classes are offered at a variety of locations in the LexMed network. And for those living with type 2 diabetes, the D2Me Wellness and Support Group is for you. The class is totally free of charge. That information is listed on your screen.